Hello everyone. Today we will be talking about importance of maternal history in congenital heart disease. As we all are aware of that, if a mother get exposed to any drug or infection during the first trimester of pregnancy, there are high chances that the child may develop congenital abnormalities because all the organs in the child forms during the first trimester of pregnancy. So any exposure, any drug or any infection can cause some congenital abnormalities. So we should be aware of these congenital abnormalities so that we do not prescribe them these drugs unless and until it is absolutely required. So first going to systemic lupus erythematosus, SLE, is normally associated with what is called as Sjogren syndrome. Sjogren syndrome contains antibodies like anti-Ro and anti-La, and these antibodies can go and attach to the AV node and can lead to complete heart block. Phenylketonuria is known to cause ventricular septal defect, atrial septal defect, and PDA. Diabetes can be a commonly associated finding in any mother, especially in pregnancy during after 30 years of age, can cause what is called as transposition of great vessels, ventricular septal defect, AV septal defect, and hypoplastic left heart syndrome. But importantly, in this, transposition of great vessels and ventricular septal defect has to be noted. Coming to infections, whether if you get any infected rubella, high chances of getting patent ductus arteriosus and second pulmonary stenosis. Mumps can cause endocardial fibroelastosis. It is a condition in which the endocardium is replaced. The endocardium is actually replaced with a fibrous like this collagen and elastin fibers, and thus making it endocardium, making it leading to diastolic as well as systolic dysfunction. So this is very rarely seen nowadays because the mumps infection in pregnancy is very unlikely to occur. Third is Coxsackie virus, cytomegalovirus, herpes virus. In the late pregnancy, all these things can cause myocarditis. Coming to drugs, exposure to progesterone and estrogen in excess or can lead to ventricular septal defect, tetralogy of Fallot, and transposition of great arteries. Lithium can cause Epstein's anomaly. Epstein's anomaly is nothing but there is abnormal insertion of the tricuspid valvular leaflet, which can lead to large tricuspid regurgitation and a decreased functional right ventricle. Valproic acid, sometimes patient on Caesar patient or history of epilepsy in any other mother, maybe on valproate can lead to atrial septal defect, ventricular septal defect, and TOF. Retinoic acid, that is vitamin A, can cause conotruncal anomalies. This conotruncal anomalies is nothing but is tetralogy of Fallot, truncus arteriosus, double outlet right ventricle, double outlet left ventricle, transposition of great arteries. Amphetamines exposure can lead to VSD, ventricular septal defect, patent ductus arteriosus, ASD, and TGA. Phenytoin can cause pulmonary stenosis, aortic stenosis, and coarctation of aorta. Paroxetine, which is an SSRI, can cause atrial septal defect, VSD, and outflow tract obstruction. Nitrofurantoin is an important drug which is given for urinary tract infection, can cause a hypoplastic left heart syndrome. Trimethadione is known to cause VSD, pulmonary stenosis, transmission of great artery, tetralogy of Fallot, and hypoplastic left heart syndrome. Ibuprofen can lead to transposition of great vessels and ventricular septal defect. Coming to ingestion and exposure, ingestion of alcohol during pregnancy can lead to VSD, ventricular septal defect, and patent ductus arteriosus. Smoking can again lead to patent ductus arteriosus. Marijuana or cocaine abuse can lead to ventricular septal defect. So we should all be aware of all this congenital heart defect which can occur. So all these drugs has to be used only if absolutely required, or other if there is an option of using alternative drugs, it's better to choose alternative drugs. And again, we should remember that all these things can cause congenital abnormalities only if you are exposed during the first trimester of pregnancy. Hope you have liked this video. If you want more video like this, do subscribe to my YouTube channel, Dr. Akif Baig. Thank you.